This week on ANN, the Adventist Development and Relief Agency continues to assist thousands of Venezuelan migrants.
2 people are killed on the way to a Pathfinder camp in Papua New Guinea, while others are still in critical condition.
And Loma Linda University Children's Hospital is recognized for excellence in life support.
These stories and more coming up.
Thank you so much for joining us this week.
First in the news, thousands of Venezuelans have migrated to Colombia because of the economic and political situation. Many in Venezuela have no safe place to live and have no money to buy food or get health care.
According to national government statistics, as of January 31st of this year, more than 1.7 million Venezuelan migrants are living in Colombia, of which 54% are living in irregular conditions.
The Adventist Development and Relief Agency, or ADRA, in Colombia and the United States Agency for International Development, known as USAID, have partnered since 2018 to offer services to migrant families. Its latest partnership project, coined as SHAWA, which stands for Optimized Health and Wash Activities for Migrants in Colombia, has been offering primary health services since May.
Director for ADRA Colombia, Jair Flores, says, "We are thankful to God because we have been able to assist so many in these two departments through justice, love, and compassion, which we profess in ADRA Colombia. We are delighted to be part of those being benefited, taking hope to those who, for different reasons today, have no health coverage. Thanks to this project, they can get a medical consult, basic laboratory tests, and medicines."
So far, more than 114,000 persons have benefited from the ADRA Colombia and USAID partnership through health services, water and hygiene kits, as well as with settlements throughout the country.
The SHAWA project, which is the third phase of the ongoing partnership, consists of 2 mobile units equipped with a generator, a medical office, space for medicines, a restroom, a lift for those with disabilities, and wheelchairs provided by the Ministry of Transportation.
Hundreds of Venezuelans have benefited from the program with medical attention, medicines, laboratory test authorizations, and training on sexual and reproductive health, among others.
ADRA Colombia has been committed to programs that assist Venezuelan migrants since many began their journey throughout Latin American countries, but especially in Colombia with the highest number coming in.
During a visit to one of the mobile units, German Marian, health director of the Ministry of Health in the Santander government office, congratulated ADRA Colombia for its ongoing project to assist those more vulnerable.
ADRA Colombia leaders said that the project will continue for months.
2 people from East Taraka Seventh-day Adventist Church in Papua New Guinea have been confirmed dead, and others are in ICU after being involved in 2 separate motor vehicle accidents on the way to a Pathfinder camp in Ley, Morobe Province on July 24. According to a Facebook post, the first accident involved a Pathfinder director who was driving a group of young Pathfinders to a camp organized by the Morobe Mission Youth Department. Sadly, the Pathfinder director died, and many of the Pathfinders are currently in ICU in Ley's Angao Memorial Hospital. After the accident occurred, a parent was notified and decided to travel to the accident site, but was killed in a separate accident along the journey. According to another Facebook post by a fellow church member, Charles Billison, Joseph Ken from Tomba, Western Highlands Province, was one of the casualties. He was described by Mr. Billison as a man after God's heart who was always willing to use his vehicles for God's service, a man with an open heart to the poor and needy. Adventist Record will update this information as it becomes available, but in the meantime, we ask you to pray for the families of those impacted. You can learn more at record.adventistchurch.com.
Loma Linda University Children's Hospital has been recognized as a recipient of the Gold Level ELSO Award for excellence in life support from the Extracorporeal Life Support Organization for 2021. The Excellence in Life Support Award recognizes centers that demonstrate an exceptional commitment to evidence-based processes, quality measures, staff training, continuing education, patient satisfaction, and ongoing clinical care. LLU Children's Hospital was selected as a center of excellence for demonstrating extraordinary achievement in the following three categories: excellence in promoting the mission, activities, and vision of ELSO, excellence in patient care by using the highest quality measures, processes, and structures based upon evidence, and excellence in training, education, collaboration, and communication, supporting ELSO guidelines that contributes to a healing environment for families, patients, and staff. LLU Children's Hospital provides extracorporeal membrane oxygenation, or ECMO, for the support of failing organ systems in patients, including infants and children. ECMO is one of the most advanced forms of life support available to patients experiencing acute failure of the cardiorespiratory system. ECMO allows time for the patient's lungs or hearts to heal over a period of time by using a heart lung machine to oxygenate blood outside of the body. ECMO and the team at LLU Children's Hospital have saved hundreds of critically ill children that required a transplant.
On April 9, the La Soufriere volcano erupted for the first time after 40 years, sending an ash plume 6.2 miles high into the sky and reaching far enough away to affect Barbados, Grenada, and St. Lucia. The resultant ash fall was very heavy in the surrounding areas, reaching the nearby islands and halting area air traffic. An estimated 23,400 people were displaced to the southern end of St. Vincent Island and some neighboring countries. Following initial assessments on the ground, ADRA declared an emergency Category 2 response according to its global emergency response mechanisms and rapidly started providing food assistance to displaced people at 9 shelters. By the end of July, more than 87,000 hot meals had been distributed. With the support of local partners and in coordination with the local government, ADRA also provided cash assistance to more than 1,900 people whose livelihoods had been severely impacted by the emergency. Cash and voucher assistance provides affected people with the means and flexibility to decide and prioritize their recovery. In emergency contexts, cash assistance allows more aid to reach the beneficiaries directly, supports local markets, and lays the foundations for communities' recovery and resilience.
A small congregation of Seventh-day Adventists in Panama recently launched a community-wide impact initiative across the financial district of Panama City, a metropolitan area still dealing with the challenges brought on by the pandemic. The activity, coined as Be a Hero, Save Lives, was organized by the Bella Vista Adventist Church and featured a blood drive and free medical checkups. Organized in January 2020, the small congregation grew out of a small group that then grew to 30 members and later to 50. Dozens of persons in the community were assisted at a time when preventive health care can make a difference in their lives. Onlookers learned about the 8 natural remedies of the I Want to Live Healthy initiative and were invited to join virtual workshops on nutrition, diabetes, weight management, and more. Personal Ministries Assistant Director for the Bella Vista Adventist Church said, "What seemed like a challenge to members ended up being a great opportunity to see God act powerfully in this project of saving lives in the community and allowing us to be valuable instruments in His hands. This allowed us to testify of God's love and mercy in a practical way by sharing wellness and hope with our neighbors." More than half of the 54-member congregation took part in donating blood and assisting throughout the initiative at the Andrés Bello Park on July 10th. Each year, since 2015, the small group has offered seminars on finances and vegetarian cooking classes. Church members have joined efforts to distribute safety kits with face masks, as well as distribute more than 480 missionary books on living in uncertain times. The congregation has also distributed food baskets to needy families in the communities. The small Bella Vista congregation dreams of having their own place of worship with enough space for a community center that can better impact the community of nearly 30,000 people. Plans are to hold a second donation drive with more of the community participating.
ADRA in Bulgaria is responding to the continued COVID-19 crisis through a series of projects that will target thousands of Roma, homeless, and socially vulnerable groups in Bulgaria.
Health indicators show Bulgaria falls behind most countries in the European Union in economics and life expectancy. The rate of adult smoking and alcohol consumption is also the highest in the EU, with more than 1 in 4 adults smoking daily.
Local reports indicate the general population oppose being vaccinated and dismiss federal mandates to keep safe, such as wearing a mask and keeping 6 feet apart. Only 10% of Bulgarians are willing to be vaccinated compared to 52% who have refused, according to official findings published in February.
ADRA found in its assessments that there is a need for informing and motivating communities in Bulgaria with reliable information. Key components of the information would include ways to self protect against COVID 19 and appropriately define what immunization means and share what are options to do so.
Last year, ADRA successfully cooperated with psychologists and psychiatrists for the COVID-19 emergency project, partnering with GIP Sofia. This year, they plan to organize personal sessions for physicians to receive psychological assistance during this stressful pandemic. They are expecting at least 100 physicians to participate.
A facility in Pazartek has been planned with the threefold purpose of being an influence center, a medical facility, and a social center. The location was chosen after research and consultation with local authorities and Adventist churches. The government will finance all the social activities there, including part of the medical ones.
The center will allow affected communities access to COVID-19 testing, vaccines, free dental services, psychology services, and general medical assistance. The health center will focus its COVID-19 prevention approach around 4 priorities: contain the spread of the virus by teaching protection and basic hygiene,
Decrease the deterioration of human assets and rights, social cohesion by focusing mostly on the poor communities and among them the Roma community who are too often ostracized.
advocate vulnerable communities about the advantages of vaccination,
Offer free medical checkups to early diagnose and treat the diseases proven to be the main risks for COVID 19 infections.
ADRA leaders in Bulgaria feel that with the health center in Pazartek, we'll see an average of 2,000 beneficiaries receive access to healthcare per year.
ADRA is partnering with the Adventist Church to help run the center with the support of local volunteers, nonprofit organizations, local authorities, and community associations.
Coming up, Adventist Healthcare named top workplace in the Washington, D.C. region.
But up next, Caleb Mission in South America is transforming lives.
We may look, pray, read, think, worship, sing, and share differently, but we all look forward to the Sabbath. And we all look forward to the future when Jesus will come again. With this message in mind, we arrived at a core component for a new identity system: the creation grid, a simple 7-column structure for layout. The grid is a reference both to the prophetic timeline as well as to the creation week that culminated in the 7th-day Sabbath. Regardless of what or where you are designing, you can always find information to help you communicate that we are all Seventh-day Adventists.
Welcome back.
For many people, July is the month of vacation. Whether from studies or work, the break is used to travel or rest at home.
But for Adventist Church youth in many of South American countries, July is dedicated to the Caleb Mission Project. Young people donate their vacation to bring love and hope to communities and neighborhoods through social actions and Bible study.
One of the places that received the young Calebs was the Bom Sucesso community of Brazil, located in the interior of Amazonas, where it is only possible to arrive by boat.
While it is a peaceful community, Mario Jorge, a fisherman, explains that unfortunately drugs are present.
And it was in this context that the young Adventists of the Caleb Mission Project came to the community to make a difference and show that Jesus can transform lives.
The South American division sent this report.
Bem, eu moro a alguns quilômetros da cidade, mais ou menos 60 quilômetros da cidade de Quari. dentro do lago de Quari, Quari Grande que chamamos, e uma localidade de Tibiã. Bom Sucesso do Tibiã. Para chegar até minha casa só de barco.
Geralmente o dia a dia é amanhecer o dia, depois do culto, sai para a roça, as mulheres também acompanham. As mulheres aqui, ela acompanham o homem. Elas estão também ajudando os homens no cultivo da roça, né? Da banana e da macaxeira, tudo isso. E tem também a pesca. Uns saem para pescar, colocar a rede, que é a malhadeira, pegar o peixe. Aqui, graças a Deus, sempre é uma família, né? É uma família carnal, né? E também espiritual.
Eu era alcoólatra, eu fumava, eu bebia, eu era uma pessoa muito que não respeitava minha esposa. Coisas que às vezes a gente para pensar e imagina que era só coisa ruim, não tinha coisa boa. Era coisa ruim mesmo que eu fazia. A coisa mais ruim que eu achava era que eu, sei lá, traía minha esposa demais.
O Oswaldo era um menino muito rebelde. Ele usava droga, bebia. Mesmo com casado, ele também vivia com outras mulheres assim.
Mas o Oswaldo, a vida dele era meio complicada, né? Complicado mesmo. Ele era daqueles que bebia, ele fazia coisas erradas, né?
Mas graças a Deus a Missão Caleb me encontrou e nós fizemos o evangelismo aqui. Eles fizeram o evangelismo, pastores vieram, fizeram o evangelismo, se casemos, se batizemos.
E com a Missão Caleb, não, ele aceitou e foi batizado, e graças a Deus, hoje ele é um líder da igreja.
Eu estou me acostumando com a palavra seu Oswaldo. Eu não tinha essa palavra no meu vocabulário, não tinha. E hoje eu passo por aí, seu Oswaldo, tudo bem? Eu digo, tudo bem. Seu Oswaldo, eu vou matutando esse seu Oswaldo, até que ponto eu cheguei, né? De ser um homem respeitado.
A missão do Caleb foi muito legal e ajudou muito as nossas famílias e as outras famílias, a minha família, né? Que a gente fazia uma coisa que nada agradava a Deus. Agora a gente prega para outras famílias.
A missão Caleb, ela transformou a nossa vida.
A minha missão hoje é levar o evangelho, é pregar o evangelho, levar aonde for. E agora com a cheia grande, a facilidade está fácil. Então chegando bem perto da escada, da porta, chega lá, dá um folheto. A gente vê a fragilidade das pessoas. Não tem Deus lá. A gente chega, entra com Deus, pede, com licença, podemos abrir a Bíblia? Pode sim, irmão. E a gente começa a falar e a pessoa começa a escorrer a lágrima. Deus levanta pessoas de onde a gente nem imagina. E hoje eu sou um Caleb. Eu me consagro como um Caleb, pregando o evangelho para todos no beiradão aí.
Olha, a gente geralmente, como ser humano, pensa assim que não tem jeito, né? Sempre a gente pensa assim, mas graças a Deus o poder do Espírito Santo opera na vida das pessoas.
Pela graça de Deus, ele aceitou a palavra hoje. Hoje ele é um homem de Deus.
Se tem salvação para o Oswaldo, tem salvação para qualquer uma pessoa que acredita em Deus, né? Acredita na palavra, no amor de Deus.
Na missão Caleb me encontrou, agora eu quero encontrar como eles me encontraram. Meus amigos, tudo por aí. Aonde quer que eu for, eu vou levar o amor de Deus para eles.
Adventist Healthcare recently earned a spot on the Washington Post's list of top workplaces 2021 in the Washington, D.C. region of the United States.
Adventist Healthcare was the only provider of medical services on the list of 200 employers from public and private industries, nonprofits, and government agencies. Adventist Healthcare was one of only 12 organizations that the Post honored in the largest companies category.
Rankings are based on a survey of employees conducted by the Post through its research partner, Energage. The anonymous survey asked employees to rate their companies in areas related to workplace culture, including connection, leadership, engagement, pay, and benefits.
The Post invited 3,500 employers in the region to participate. In announcing the ranking, the Post noted Adventist Healthcare's mission of whole person, faith-based healthcare.
In the survey, the Post quoted an employee as saying, "I enjoyed talking with my patients and leaving them uplifted and hopeful."
Adventist Healthcare provides comprehensive health and wellness services to the communities it serves in Maryland and Washington, D.C. Its mission is to extend God's care through the ministry of physical, mental, and spiritual healing.
Coming up, Elizabeth Henry is here for This Week in Adventist History.
But up next, Adventist Mission shares the story of a school renovation on the island of Ebeye.
Hi, VL. How are you? Are you okay? Dear VL, I can't even remember how long we've been staying at home now because of this virus. For now, it's just nice to hear your voice and see your face. Nothing beats playing outside in the dirt though. Which reminds me, are your hands clean? Yes! Mommy and Daddy says not a lot of kids get COVID-19, but it's always nice to be extra safe. We should wash our hands before picking our nose. Washing our hands protects us, but it also keeps us from spreading the virus. In case we touch something dirty. Let's always be clean and safe, okay? Love, Joey.
Welcome back.
A Seventh-day Adventist school is located on the island of Ebeye, where more than half the population is under the age of 18.
Thanks to the 13th Sabbath offerings in 2018, Adventist Mission was able to help repair the school.
Adventist Mission has more.
One of the world's most densely populated islands is home to a Seventh-day Adventist school. More than 15,000 people live on Ebeye, and more than half of the population is under the age of 18. We visited this small island in 2018 when a portion of the 13th Sabbath offering went to help repair the Adventist school. They were having problems with termites and rapid deterioration from the highly concentrated salty air. The Ebeye Seventh-day Adventist School educates more than 300 students from pre-kindergarten to grade 12. Students learn a variety of subjects, including the Bible. The school even holds church services in their chapel. Thanks to your contributions to the 2018 offering, renovations to the floors and walls of the first and second floors is complete. Now staff and students can use the library and offices, attend class, and go to chapel without worrying about a deteriorating building. And they are so grateful for your gifts that made this happen. Schools like the Ebeye Adventist School are part of the Guam Micronesia Mission in the North American Division. They rely heavily on Adventist volunteers to fill the many teaching positions throughout the territory. Each year, dozens of student missionaries answer the call to serve throughout the region in places like the Marshall Islands, the Federated States of Micronesia, Guam, Palau, and the Mariana Islands. This territory has Adventist work on 26 of the 92 inhabited islands, making schools like the one on Ebeye a valuable space for the islanders. During the pandemic especially, there has been a need for more Adventist volunteers. If you feel impressed to serve, visit vividfaith.org to browse open calls from around the world. Please pray for the Guam Micronesia Mission and the teachers in schools throughout this territory. Thank you for supporting mission through the mission offering and perhaps even by answering God's call to serve.
Watch this and other mission stories online by visiting adventistmission.org. Then click on videos at the top.
And finally, for today's episode, let's turn to Elizabeth Henry for a look at Adventist history.
This week, we hear about the life and ministry of evangelist Jules Ray.
Welcome to This Week in Adventist History. Jules Ray, an evangelist and administrator, was born in February 1880 in Switzerland. He became a Seventh-day Adventist in 1900, and 2 years later, he joined a 5-month training course for Adventist preachers organized in Paris, France by the Latin Union Mission. He then moved to Geneva, Switzerland, to assist Léon Paul Thièche, the then president of the French-Swiss Conference, in his evangelistic activities. In 1905, Ray went to the south of France to serve as an evangelist, moving to Nîmes, where he organized a church of 15 members. He remained in the south of France until 1909, when he returned to Switzerland to work as an evangelist. On August 13, 1910, Jules Ray was ordained to the ministry. After his ordination, he moved to the canton of Valais, where he organized a church of 20 members, despite facing strong opposition. At the beginning of the First World War, Ray accepted a call to return to France, serving in Montbéliard and then in Paris until 1917. From the end of 1920 to the summer of 1923, he served as the president of the French Conference, then as the president of the Lehman Conference until 1928. After serving in France and in Switzerland for over 2 decades, Ray accepted the call to serve as superintendent of the North African Union Mission and the Algerian Mission. Ray worked in North Africa for 8 years, starting the publication of Arabic literature, and under his leadership, the medical work was strengthened and expanded. Ray returned to Switzerland at the end of 1936 and served as a pastor of the Lehman Conference until he retired in 1950. To learn more about Jules Ray, please visit the Encyclopedia of Seventh-day Adventists online at encyclopedia.adventist.org. This has been a look at This Week in Adventist History.
Thanks for watching ANN. Join us next week for more news from the headquarters of the Seventh-day Adventist Church.
Did you know the Adventist Church has a YouTube channel where you can watch ANN Video, ANN In-Depth, and plenty other amazing videos on prophecy, health, and Bible study?
Just go to YouTube and search for the Adventist Church. Make sure you click the subscribe button to make sure you're caught up each week.
And remember, leave a comment or prayer request. We have people who are praying for you 24 hours a day, 7 days a week.
Before we say goodbye, here's some good news from the book of 2 Samuel chapter 7, verses 21 and 22.
The passage says, "For the sake of your word and according to your own heart, you have done all this greatness to let your servant know. For this reason you are great, O Lord God, for there is none like you, and there is no God beside you, according to all that we have heard with our ears."
That's our program for this week. And remember, you can always visit Adventist.news for daily news and videos. Until next time, God bless.
Take care.